My name is Christy.mov, and I chose prostate cancer for personal reasons. My father-in-law was diagnosed with prostate cancer approximately 6 years ago, and my husband has that chance of having prostate cancer. So this is why I chose prostate cancer. I wanted to know more about it. My father didn't have any medical problems, but my husband's side has quite a few. So with us having children, I want to know what I can expect or what I should expect. I started out with cancer. I think you need to know what cancer is before you can go into the different types of cancer. So cancer is a disease caused by uncontrolled division of abnormal cells in any part of the body. So any part of the body, like we've been speaking of, if it's invaded, it's going to break down. A malignant growth or a tumor resulting from such a division of cells. So when the cells are actively dividing and they're creating these other cells that we don't need, our body's not flushing out the first set of cells, so these cells become like a tumor. And this is actually a picture of a prostate where this is the normal cell and then this is where the cancer tumor has formed inside the prostate or on the prostate. I told Dr. V I was going to find one, and I found one. A karyotype, which is what they think is occurring in prostate cancer, in men with prostate cancer. And it was done using interphase, which is rather odd. We were talking about interphase in my class today, so my 7th graders kind of got a lesson on prostate cancer in the process. Since the cells mainly hold in interphase before they start reproducing and splitting, this is where they did most of the research in that phase of interphase. And they found that a lot of times in men, in African American men primarily, which is what this study was on, during interphase, our chromosomes were being rearranged. Well, not ours. Men's chromosomes were being rearranged. Which, by the way, out of the 6 of us in this class, does everybody know only one person here could possibly have prostate cancer? That we do all understand that it is part of a male reproductive problem, not females. But with that being said, this shows some of those rearrangements that are occurring. It wasn't a lot of information on this, but this one study prompted additional studies which are going on now. The background information on a prostate, in case we don't know, again, a prostate is a small walnut-sized structure located right below the bladder. So I know people have seen the commercials when the men have, they're rushing to the bathroom and it's pressure on the bladder that's causing them to always have to go, always have to go. But this particular organ wraps around the urethra tube that carries urine out of the body. So men release urine out of the body, and this is actually wrapped around it. So if you look at it, it literally is wrapped around this particular organ. It secretes fluids that nourish and protect sperm. So in order for women to become pregnant, this really needs to be working properly. Otherwise, there won't be any reproduction going on. The risk for prostate cancer. African American men are at risk. Our men are the ones that are the unhealthiest when it comes to prostate cancer. Men older than 60. Men who have had a father or brother with prostate cancer. Exposed to Agent Orange. And I'm going to stop right here because my father-in-law was exposed to Agent Orange numerous times in Vietnam. He served in the military for 35 years. So he's not even sure what he was exposed to in the 60s and 70s. And that predisposed him to a lot of risk factors for not just prostate cancer, but other types of diseases as well. He's losing his vision right now. He's not able to walk properly. He's had a lot of issues going on since he retired from the military. Men who abuse alcohol. And we always talk about men going to bars and having a drink and watching the game. And I'm guilty of that. I will tell my husband in a minute, let's go watch the game and we'll drink a couple of beers. And I had to stop once I started doing my research on this. I was like, well, no, that's okay. We'll stay at home and watch the game, make some sweet tea. We'll make it work. Farmers are predisposed to prostate cancer. Does anybody know why?
Because of the chemicals that they use to farm.
Exactly. One thing I found out as a funeral director, I'm predisposed if I were a male. By inhaling the formaldehyde, which now with all the things that we're made to do now, we're made to wear masks. But I can remember coming up in the 70s and 80s, My grandfather would tuck his tie in, walk into the embalming room with no mask. My dad did the same thing. So they were predisposing themselves to all these different diseases even at that time, and we didn't know. Men who eat a diet high in fat, especially animal fat, goes back to African American men. We have very unhealthy diets in the African American community. We eat a lot of fatty foods. We eat a lot of pork. We eat a lot of things that are deep fried, and I could go on and on that, but we have to get better with our health. Tire plant workers. Anybody think what are they?
The exposure to the chemicals that make up the rubber in the tires.
Exactly. Exactly. Most times if you go into a factory now, they're wearing masks. 70s, 60s, 80s, they weren't wearing masks. Even in the 90s, a lot of places weren't wearing masks. Painters, lead. We don't have a lot of lead-based paints anymore, but if you're going into an old home to remodel, a lot of construction guys. And again, if I were a man, I can already look at 3 or 4 that I've exposed myself to by working in construction. But men, a lot of the guys that I used to work with in construction, we went into homes without masks on, without anything that protected us, because we just thought it was safe. And that's what a lot of it is. We always think we're safe, but we're not safe because we're not looking at the background of what could happen. And men who have been exposed to cadmium. I just love this picture. This has been a fact that is pretty much proven. Japanese men living in Japan have the lowest number of cases of prostate cancer. Now, without reading what I put on the board, can anybody think why they would have a low number of cases of prostate cancer?
Their diets are low in fat.
Fish.
Which has what?
I forgot.
Omega-3,
yeah.
Diets high in omega-3 fatty acids, low in animal fats, a lot of vegetables, a lot of fresh fruits, keep them very healthy. So therefore they have very healthy life systems. But the one thing about it is once they come to the United States, their diets change. We don't have the availability of, we have fresh fruits, but they've traveled so far that they lose a lot of nutrients along the way. So the same fresh fruits and vegetables that they would receive in Japan, they're not receiving here in the United States. So the first generation after they've lived here, they're now at a higher risk of contracting or having prostate disease, prostate cancer. Some of the symptoms. Delayed or slow start of the urinary system. It's hard to go. I mean, there's really no other way to put it. It's hard to go. Blood in the urine. If you see blood in the urine, they need to go to the doctor and get it checked. Straining when trying to use the restroom. Not being able to empty it all out at one time. You go and then 5 minutes later, oh my God, I gotta go again. A lot of times this is very embarrassing for men, dribbling or leakage of the urine, most often after urinating. It's embarrassing because they may be out in public and they realize this is happening, and then they're looking for the first bathroom to go to. And I actually had that, I don't think my father-in-law would mind me saying this, that happened to us. We were in the airport waiting on a flight to go back to Seattle, and he just kept having to go to the bathroom, and that's how I knew he's sick again. It has come back. It was never, he was in remission for about 2 years. That night in the airport, we knew we needed to go back to the doctor. Bone pain or tenderness, most often in the lower back and pelvic bones, and that's after it has spread. Thankfully his has not spread, but he does have a lot of, like I said, a lot of other underlying problems. I have a video on here, if you don't mind, Dr. B. It says 5 minutes, but I promise it's more like 1 minute and 34 seconds.
Volume.
Oh, that's so.
Yeah.
When it comes to saving energy, we're off to a good start. But now it's time to go to the next level. So let's do a little detective work. Pick up what we need, roll out,
The other one?
caulk, and install. And pretty soon we're seeing the fruits of our labor right there at our bottom line. More saving, more doing. That's the power of the Home Depot. Owens Corning EcoTouch Attic Insulation is only $9.97 a roll.
I found it ironic, however, that it was a Home Depot commercial for men's prostate cancer.
My name is Jim Korzak, and I live in Massachusetts. And my question is, what are the symptoms of prostate and colon cancer, and are there any preventative measures that can be taken to prevent them?
Well, it's a pretty broad topic, Jim. It's a good question. In terms of prostate cancer, luckily with screening efforts these days with blood tests like the PSA test and rectal examinations, we're finding more and more prostate cancers at the asymptomatic stage. In advanced cases, men may have problems emptying their bladder, they may have bone pain, weight loss. However, those are relatively rare ways prostate cancer shows up these days. In terms of signs of colon cancer, bleeding from the...
So what we just said, if your husband, son, brother comes home and says, I'm having problems using the bathroom, and we all know that men hate to say, I'm having problems doing anything. They need to get to the doctor. It is a very serious problem. I put on here, what would you do? And what would you do if your husband or brother or son came home and said, something's wrong, but I'm afraid to go because I'm afraid to find out what might happen?
I would encourage them to go. I wouldn't encourage, it would not be an option. You would either go or I would.
Put him in the car and drive him there.
Exactly.
And you have to.
You don't have an option.
You have to.
All right.
So what's next? These are the tests. You have a prostate biopsy. And it's reported on a scale called a Gleason grade. Usually, because the cells are morphing into different stages, this is added together. So say 2 and 3 are added together and you get the number 5. It's not necessarily saying that the cells are already in this state. It's just saying that a combination of these two would require this type of treatment. It's in this particular phase of prostate cancer. As the doctor was saying, the PSA test is a blood test which measures the prostate specific antigen, a protein produced by prostate cells. That test will let you know whether or not you have prostate cancer. And then again, that's where your treatment comes in. What methods of treatment do you want to have? Do you want to have surgery? They have robotic surgery. If we look at the word, the prostatectomy, it's like a hysterectomy in a female. You're removing the prostate gland. Just like in a female with a hysterectomy, you will remove whatever's damaged. You need to remove it in order for the rest of the body to repair itself. Radiation therapy, high-powered X-ray cells, kills the cancer cells. And we've all heard of radiation. It does exactly what it says it'll do. It kills those cancerous cells. Drugs, you can do a hormone therapy. And what it does is it actually, the prostate is dependent upon testosterone. But if you're not producing the testosterone that's needed in order for the prostate to work properly, this would actually slow down the effects of prostate cancer. So if you slow down the amount of testosterone that's being produced by the body, you can slow down the rate at which the prostate cancer is spreading. Or even androgen blocking drugs. This was another one, and we don't have to watch it if we don't have time, but this was actually another show that came on Fox 5 Atlanta, where they were talking about drugs that are now attacking tumor cells. And basically what it is, there's a 71-year-old man that was the first one to ever try this particular procedure. And it's kind of cool if we have time to watch it briefly. Well, it's not working properly, but basically I can tell you what the video is. It's a 71-year-old man here in Atlanta is trying this particular process where they go in and they take a certain amount of his white blood cells, and they mix it with this particular drug. 24 to 48 hours later, they're injecting it back into his body with the hopes that it's going to interact with the body's natural defenses and start breaking down those cancerous cells from the prostate cancer. There's only 2 or 3 men that have actually tried it. They're all here in Atlanta. It's done by Emory, but it's still in the clinical state. Actually, I think that was the end. And then that last one, support groups and resources. The best support group, and I love this picture, the best support group is our friends and family. Because friends and family know you better than anybody in an outside support group would know what you're feeling, what are you going through. And they can help you through that process. There are also groups that are organized by hospitals, oncologists that you can go to, but educating yourself is the easiest way.